This is Journeys with Ryan Frank. Conversations about culture and the issues affecting First Nations people in BC. Brought to you by Prince Rupert Port Authority, linking a world of opportunity. Online, rupertport.com.
Good evening. Welcome to Journeys. I'm your host, Ryan Frank, and we're on your nation, your station, CFNR. On tonight's episode of Journeys, I have Chief Rick McLean from the Tahltan First Nation. Now, he comes on to talk to me just about the Tahltan response to this COVID-19, the precautionary measures that they're putting into place, and to get some information out to the Tahltan Nation members. Now, again, if you are looking for information, you can call the Northern Health information line at 1-844-645-7811. Now, also, you can go to the World Health Organization website. It has tons of information there. It's got common questions and answers, up-to-date information as well. WHO.int is that website. Also, you can go to the BC Centre for Disease Control at bccdc.ca. Lots of great information there. So stay tuned. After these messages, I have my conversation with Chief Rick McLean from the Tahltan Nation about COVID-19 and the Tahltan response. Well, welcome back to Journeys. I'm your host, Ryan Frank, and we're on your nation, your station, CFNR. Okay, COVID-19 obviously is taking up everyone's attention. Greg has the world in obviously very precautionary measures going on, self-quarantine, lots of stuff going on. Wash your hands every day. Wash your hands a lot. If you're going to be touching surfaces that are not around your house, then you need to be washing your hands. Also monitoring your symptoms. If you are symptomatic, then you need to self-quarantine in your home, right? And go to the bccdc.ca. That's the Center for Disease Control. Lots of information there. Also go to the World Health Organization website, who.int. Also northernhealth.ca has an information line that you can call if you need to ask some questions. You can call them at 1-844-645-7811. And again, that's the Northern Health info line. Okay, so let's get to my conversation. Up next here is Chief Rick McLean from the Tahltan Nation as I sit down and have a conversation with him to talk about COVID-19 and the measures that the Tahltan are putting in place for their communities.
Chief McLean from the Tahltan Nation, Chief of Telegraph Creek and Dease Lake. And yeah, I've been on the show many times. I always enjoy coming and saying hi and having a great conversation with the one and only Frank the Tank.
Let's calm down here. We don't want Frank the Tank coming back here. Well, yeah, thanks a lot, Chief McLean. It's always a pleasure to talk with you. And now that you're all shacked up, I never see you anymore. You're going to Whitehorse all the time. Where are you at right now?
I'm in Whitehorse.
Of course you are. Jeez. Oh, I never see you anymore. What the heck? Anyways, let's move on from that. Because right now we have just a crazy situation going on in the world here. Obviously, with COVID-19 and the various measures that people are taking around the world, not just Canada, but the entire world. And I think there is something that that everyone needs to take out of this is to take this seriously, right? So what's going on with you right now? And first of all, how was the COVID-19? How did you first kind of start hearing about it? And what was your first reactions?
Well, the first reaction was watching what was going on in China, obviously, where it all started. But, to see the spread and the basically the epicenter being Europe now and how fast it's gotten around is alarming for one, I guess, and to see the measures and stuff that are being put in place to try to slow this pandemic is very trying on everybody, and everybody's trying to do their best. So we have at our level in the community, we have daily meetings with our health staff to learn and reflect on what's happened in every 24 hours and try to make the next best steps and follow the recommendations set out by not only the World Health Organization but our Chief Medical Officer in the province of BC and trying to follow those recommendations and guidelines they're setting out for the communities and then going above and beyond that as well to try to keep our elders safe and our community safe. But the most at risk it's with this COVID-19 is your elderly and people with respiratory issues. So, and our clinics aren't set up to handle and have a lot of respirator equipment and stuff like that. So we really got to take measures to keep it from coming to the community. And we have no cases now, but the measures we need to put in place to keep it that way, and if we're successful, we'll have no cases.
Yeah, no, that's very that's good that you guys are really being proactive about this, because I think a lot of people are worried, especially in our remote communities, and they're mostly First Nation communities, especially up in the north here. Our infrastructure obviously isn't the same levels as, say, a major urban center. Now, obviously, the people would worry about how can we handle stuff, but I think that might also be a bit of a blessing in disguise too. Is that the fact that we don't have those large numbers of people might actually make it a bit better for the infrastructure in those communities, and maybe not.
Well, we would always like to be able to have the infrastructure needed to handle any type of medical emergency or pandemic, which kind of puts us in a scary situation. But you know what, having low numbers and ability to contact and talk to our people very quickly is nice. But on the other hand, it's very scary because of not having that infrastructure ability. I mean, right now we're looking at, if there's any testing done, and it's a 10 days to 2 weeks to find out whether the test is positive or not. So
yes, and we were talking a bit about that before we started this conversation, because I did talk to one of the nurses here in the hospital in Terrace, and they were sending the swabs. What they do is they swab people, right, to test them. They put it in a sealed bag, and they send it off to a lab for testing. And that lab, that turnaround time was like you said, 10 days. But I can imagine with everybody in every community sending in samples, I mean, that turnaround time has got to be obviously being pushed further and further back, right? Yeah,
for sure. So I think the best steps for us to get ready for that or do it is everybody needs to be self-aware and take responsibility of their whereabouts and their health and well-being, right? So to self-isolate yourself if you have symptoms, make sure that you don't go in public places and this whole social distancing thing needs to be taken seriously and not contaminate anybody if you have any type of flu symptoms whatsoever. So that is really important. And then being aware of where you have been, if you've traveled, who you've been in contact. You have to take stock of all of those things now to understand if you do contract it, you need to know where you need to trace and who you've talked to and who you've been in contact with. So all of these things need to be taken on as an individual responsibility as a person. No government, no law enforcement, no medical officer is going to do that for any individual. So the awareness and education of every individual of their surroundings needs to be the key piece of information sharing that we need to get out there, right? People need to be self-aware.
Oh, man, and I couldn't agree with you more. I mean, I think that we can tell people what to do, I mean, till you're blue in the face, right? But you really need to take it on as an individual and follow the measures that people are talking about. Social distancing up to 2 meters, so it's like 6.5 feet. If you're feeling sick, stay home, isolate yourself, or quarantine yourself, self-quarantine as they're calling it. Now, I did talk with one of the medical officers from First Nations Health Authority, Dr. Nell Wyman, and she's saying that if you're quarantining yourself, that's fine. You can still go outside, but you just don't go to public places. That doesn't mean go to the coffee shop or go to a restaurant. It means go outside for a walk and get some fresh air. That's fine, but don't be like going around other people if you're sick and self-quarantining, right?
Yeah, absolutely. And I think one of the great things about where we live in the north is there's a lot of outdoor activities that we can do, and there's very, our numbers aren't that big, so that you can get out and go snowmobiling and go ice fishing and go skiing and go snowshoeing, all those type of things that you can do still without coming in contact with a lot of people and without having to go to a very public place. As you know, and I know that a lot of these places are shutting down anyways, right?
Yeah.
The coffee shops are drive-through only. There are a lot of places that are really putting the measures into to really try to get a handle on the spread of this sickness.
Yeah. Well, and everyone's going to have chopped firewood for the next 4 winters now, I guess, with all the time on their hands.
And the honeydew lists are going to get completed, and you know as well as I do how much we watch sports. And
man, I can't even get it. I don't even want to talk about that because it's like I'm too upset. I did record the Super Bowl though, so I was watching that yesterday from the beginning and watching the whole thing. That's pretty awesome. But I mean, obviously you did touch on the most vulnerable people in our communities, and that's why we're doing all these precautionary measures, right? You talked about the elderly, the elders, anyone that has a compromised immune system. I mean, you must have been getting a lot of messages from our nation members about that.
Yes, absolutely. And we have daily management meetings with our health team and whatnot. We're directly contacting each elder by the phone. Not everybody's on Facebook, not everybody has internet, so almost everybody, but just having those conversations because they are people are isolating themselves. So just having those conversations with somebody, it also boosts morale and gives them somebody to talk to, right?
Yeah.
So,
yeah.
But we're taking it to a level where we're going to set up shopping hours in the store for elders who want to get out and come and buy their own groceries. But we're also offering to pick up groceries for them and deliver them as well as making sure that medications are ordered and people are taken care of with their prescriptions and whatnot. Because we have closed our health center. It's by appointment only, so you can just make sure that we keep that social distancing. We don't have a bunch of people sitting in the waiting room and whatnot. So it's all by appointment only to keep it safe like that. And then also, informing people who are traveling to the community and who come from outside. We have medical transportation that are bringing people to appointments in Terrace and what have you, coming back to the community and making sure that they self-isolate for when they get back to the community, because it's just we don't know how far and wide this thing is right now. As we heard, there's some cases in northern BC, but without having the knowledge of knowing where those cases are, we need to act like they're in Terrace or in Dease Lake, right? I
was just going to say that you might as well just act like it's in the area, and that way you'll follow these precautions, right? Now, you also made a good point about traveling and whatnot. Now, one of the things that you and I have talked about, and a lot about, is economic development, but also mining, right? So we have Red Chris Mine, Bruce Jack Mine in our area, plus a lot of exploration work. Obviously exploration's not right now, I guess, but what are some of the measures that have you talked with the mines that, like at Red Chris? Have you talked with Bruce Jack about workers that are traveling in? Because a lot of workers come from other areas. So have you talked to them, and what type of measures are you putting in place to make sure you're protecting the community?
Yes, very good point. And we have had conversations with the mine and their medical teams, Bruce Jack, Red Chris, where a lot of our people are working right now. So they're following the standards set out by the World Health Organization and going beyond, as well as the Chief Medical Officer's recommendations. So they're doing that, but they're screening people when they come into camp, checking for fevers, coughs, anybody with feeling ill. They've self-isolated in their rooms. They've upped the cleaning staff to do, regular cleaning on site, and they're doing a lot of work to preventive measures to make sure that the workers are safe and the communities are safe where the workers go back to after their shift work. So, and we're asking, the workers to be aware when they come off shift. I know we have shift change, at Red Chris 5 days a week. So, people are traveling throughout BC, Alberta, Saskatchewan, going back to their families and back to our local communities. So we're very aware and working with the mine to make sure that we have the commitment to making sure that everybody is safe and taken care of as best we can. So we've had a lot of good conversation and dialogue with the mines to make sure that our people are taken care of.
Yeah, that's good. It's pretty amazing how something like this happens and it just changes like the way you look at everything. Now, all of a sudden you're looking at, okay, where are all these workers coming from? How much are they traveling? Just individual actions on the job site. Like you said, when they have shift change, even like they have to be careful of washing their hands. It's like, isn't it amazing how it just everything has kind of just really changed in the way you look at everything in the world?
Well, I think it's definitely a huge eye opener, and a lot of the stuff is going to become the new norm for further outbreaks of other sicknesses and diseases, right?
Yeah.
So, we went through SARS and other stuff earlier on, and now we have a new one. So, and this is, although they say it's a flu-like symptoms and whatnot, and attacks the elderly. Well, it really certainly prepares our society for when something really bad starts. And I'm not saying this isn't bad, but when something that attacks the masses, whether you're old or young, comes along. So preparing and getting us ready for the new norm of how we conduct ourselves in the social society that we live in, and people we're herd animals. We're social people. We rely on one another, right? And then that's what we have to do now. Is we still need to rely on one another, yet keep our distance.
Yeah, definitely. And that's the thing too. Is like we need to, like, I think like SARS, we went through that, and I think every country was slow to respond. And you see this time we've learned from that, and we were actually putting a lot of different measures in place, the social distancing, but also the canceling of big events, right? It was at 250 plus people. They said don't do them. Now it's down to 50 plus, but I mean some events have been canceled up in the north, up in even Whitehorse too, right?
Yeah, well, I mean, and I think the Arctic Winter Games was the first large event that was canceled of all, right? They had to make a decision, a tough decision, knowing that a lot of athletes were coming from the Scandinavian countries in the Northern Hemisphere where there was outbreaks already, and they already had cases, so they had to make that decision before the games got started. And then from there, it kind of snowballed across the world on major sporting events as COVID started showing up everywhere. Yeah,
like the all-native hockey tournament was the big one too, right? That was...
Oh yeah, that was a huge one. I mean, our people were we rely on that tournament every year as a big social gathering here, the Yukon all-native hockey tournament, and the organizers there had to, although they were assessed and chief medical officer said it was still a low-risk event, but as the things played out every 24 hours, they had to make the decision to cancel the event this year. So it's and even before they canceled it, there was already teams dropping off.
Because I did see some of the teams on Facebook. Some of the coaches of the teams were like putting Facebook posts asking their team, "Hey, can we decide about this?" or "What do you think we should do?" Just trying to get feedback from their teammates, because a lot of those teammates are spread around the country as well.
Yeah, and these decisions aren't taken lightly, and it takes the whole board or whole group to make a decision and have an informed decision. So you can't be just hasty and jump out there. I know different organizations get criticism for not acting fast enough, but these decisions are big and broad, and there's implications to everything, and then they need to be well thought out, and the message needs to be done properly. So it takes a bit of time when you have to make these large decisions, and the people behind them, take it very seriously.
Yeah, no doubt. I think it's important. I mean, we had the junior all-native basketball tournament was supposed to happen in Kelowna as well. I was supposed to be there right now as we speak, but the organizers and there was lots of people going on Facebook, and the thing is about those type of events is obviously the players and the families, especially in the junior all-native basketball tournament situation where they're kids. I mean, they do a lot of fundraising, a lot of work to get to that point, and then it's like they're all devastated, right? And it's crappy for everybody, but all these organizers are making the right decision. And as you see it, it's unfolding daily, hourly, really, when you think about it. I mean, at the time, these events, it was 250 plus of people. Now it's at 50 plus people they say don't have it, right? So, I mean, they all made the right decisions. And again, I always like to reiterate this, is that it's precautionary. We're doing this so that we can slow the spread of it, flatten that curve, as you've heard in media, and we want to do that so we don't overwhelm our healthcare system. I mean, I feel like the healthcare system is going to be overwhelmed no matter what, but let's try to lessen and slow that impact a bit, right?
Oh, yes, absolutely, because our facilities aren't set up for massive intakes of patients, right? And I think, for the most part, there's nothing they can really do for a patient other than make them comfortable. So, and the breathing and the respiratory devices that are needed, not every hospital has an abundance of them, right?
No. One person, a professional I was talking to, said there's 3,000 to 3,500 ventilators across Canada.
Yeah, so that shows the importance of us taking all these precautionary measures and making sure that educating the public, educating our members, and making people aware of what they need to do to take care of themselves and their community, of their elders, right? I mean, we got to separate ourselves and social distance ourselves, but we have to come together to to take care of each other.
Yeah, no pun intended.
That isn't ironic, right?
It is. Because I know that is the thing too, is that, in Canada here, we really need to work together. And I think Team Canada, which I heard this morning, I think from some of the Canada Health Safety Officer, Dr. Lamb, just talking about Team Canada and coming together and working that way, making sure you check on people. If there's vulnerable people in your community, to make sure that they're being checked on and looked after. I mean, you can just make a phone call. It's not too difficult to do that with the technology that we do have. But again, we do need to work together and we need to take it seriously. I think people are, with the amount of media that's on all this stuff, but people start to get a little bit fearful. They see stuff online, which another thing, social media has been, I think, ridiculous in a lot of ways, but also good because you get information out. But I mean, you see people panic buying, right? Like, what's the deal with toilet paper? I can't get my mind over that. Have you seen a lot of that in your experience so far?
Well, yes, absolutely, and the thing about it is, it's uncalled for and unneeded, because we hear from suppliers across the world that everybody's well stocked, so we don't need to run out and one family buys all the toilet paper while it puts another family out. So, in fact, we're actually going to make sure that there are restrictions in our store that make sure that customers get limited items so that everybody gets a chance to buy what they need and have what they need. So that it's as crazy as it is. It's the fear and the herd mentality and social media world that we rely on to get out information and share information. Yet it creates fear and panic, and people go and as we've seen, have bought up every roll of toilet paper.
Yeah,
made,
it's crazy.
If they could. So.
Well, did you see that there was that couple in the Lower Mainland that bought like $100,000 worth of everything? Was like all the wipes and toilet paper and stuff?
No, but that sounds very very ridiculous. I hope that people don't continue to go to those measures in their northern communities and just continue to buy what you need and survive on, and we're able to help our neighbors and the elders and community, right? So I really hope that we can conduct ourselves in a good social way that takes care of one another.
For Tahltan Nation members, where are they going to be able to get more information? I know you've talked a lot about it already. For the elders, you're calling them and making sure they're okay, grocery hours, but also following all the measures, which is social distancing, self-quarantining if you have any symptoms, if you've traveled anywhere to self-quarantine. But if there are other information, where should Tahltan members go to?
Well, if you're in the community, like in Telegraph Creek, and you're feeling symptoms, we can call the health center at 250-235-3211. Or in the north, we have the 811 Health Link BC, which gives information and helps people get informed of what measures they need to take place. Right?
Yeah.
So, your local health what we're asking people to do is if you're feeling symptoms and you're feeling sick, don't go to the hospital. Phone in. If they need to, they'll come to your house and get tested and whatnot there. But don't go to the medical centers if you're feeling ill. and you have the symptoms. So phone in, and they'll make arrangements to get testing done. So that's a really important piece of information. So we have the Telegraph Rec Center Facebook page where we're posting a lot of our information from the band, as our own Facebook page is down right now, and we're revamping it as well as our website and whatnot. So we're using our Telegraph Creek Rec Center Facebook page. We're posting a lot of our information. We have a lot of postings in the community, on the store, on the door of the rec center, as our rec center is closed. But we're asking people to pay attention, read the postings on the pumps and on the doors, and we are reaching out and calling our elders individually, talking to them on the phone. So a lot of that stuff is happening. And we're very, very pleased with the efforts of our health staff. I'm really, proud of the work that they're doing. Our daily meetings, everybody's having great ideas, really trying to be supportive of the community, trying to make sure that everybody's taken care of. I really would like to commend them for the efforts that they're putting forth to keep our community safe. So I'm really, all the health workers and frontline staff, I think, in Northern BC, in the CFNR world out there, that need to know that we're very appreciative of their efforts.
Yeah, I know. I was just thinking about that. Like, as you know, I'm obviously in the media here. I'm watching everything, reading as much as I can about it, and I kept thinking about that. I was like, okay, imagine how some people are scared or don't know what's going on. But then imagine being a frontline worker. Imagine being a nurse or a doctor that's right there dealing with all the people that are sick and do test positive. I mean, those people are like heroes. They are heroes, right?
Absolutely. And the efforts that go into taking care of the community that they do is second to none. And I really hold them up in highest regard for them stepping up and taking on those roles. And we don't have enough. And I always like to encourage our young people to consider roles in the health field that is very rewarding and whatnot. But you also put on the front line of danger as well. So they're taking risks to take care of our people and take care of the people of the north and of Canada and the world, really.
Yeah.
So we're always, aware of that. And then, along with that, we have to think about the mental health of those individuals and everybody else, right?
Yeah.
As you know, our community came through the wildfires of 2018, and there's a lot of, stress and mental issues that, this starts being quarantined and in your homes, bringing back memories and realization of being in an emergency situation. So we went from wildfires to, our road getting landslided out last year, and now we're into pandemic. So
yeah, crazy.
It's a lot of stress on our community. Just reliving and continuously in emergency situations. So, our health staff and our frontline workers have been at this emergency management stuff for, 3 years now. So
yeah, you guys are going to have to write the book on this stuff, I think.
Well, we definitely have a responsibility to share a story and try to help other communities prepare and plan for these type of emergencies, right?
Yeah, and that's what I was, when you started talking about the wildfires, that's in my head before you even mentioned that. That's what I was thinking in my head. I was like, you just read my mind, because you guys have experience in setting up an EOC, an Emergency Operations Center, and I mean, I bet you guys probably just kind of fell right back into that mode again, right? Just set up the, I don't know if it's an EOC technically called that, but basically it acts like one where all your professionals are together. We're talking about what's happening, what's the current situation, what's the proactive measures you can take, right?
Oh, absolutely. And the thing about it is our new emergency plans and the way we're trying to roll out, keeping them active is depending on what emergency or what the crisis is, who gets called to the table, right? So be it a physical one where the road got washed out, who get called in, wildfire who gets called in, or this pandemic one who gets called in, or if it's down to the community or family level who gets called in. So that emergency plan is consistently being used and updated and practiced all the time. So that's one of the things we've learned from the emergency management plan that we have and had to get updated since the fire.
Yeah, crazy. Well, lots of stuff going on. I mean, it sounds like you're being very proactive, which is awesome, and working with your elders and stuff like that. And people can get the information. If you're a Tahltan Nation member, they can get them from the community. Your postings up there. You're calling people. You're using the Tahltan or the Telegraph Creek Rec Center Facebook page for postings right now, because the actual Tahltan Band Facebook page is down, correct?
Yes.
Okay.
And the other line is we do have the Northern Health online clinic and info line. That is 1-844-645-7811. And there's information and the online clinic there that's available for all people in the north. So
yep.
Please refer to that as well. And if you're coming or traveling into the community, please take all precautions to self-isolate and social distance, and take care of yourself and take care of your family at the same time. We're really hopeful that we can get through this pandemic with minimal damage.
Thank you, Rick McLean, Chief Rick McLean, for taking the time to speak with me today. I really appreciate it.
All right, appreciate the call.
And there you have it. That was my conversation with Chief Rick McLean from the Tahltan Nation, and they're being very proactive up there, obviously working with their elders, making sure that they are taken care of, also following all the precautionary measures that we've been hearing as far as social distancing, self-quarantining if you've been traveling or have any symptoms. Also, the info line is there, 1-844-645-7811. That's the Northern Health info line. You can also go to their website, northernhealth.ca. Also, you can go to the World Health Organization, WHO.int, or the BC Center for Disease Control. That's bccdc.ca. Lots of great information on all those websites. The Northern Health info line is great. Also, if you are currently sick and you have all the symptoms, you're told not to go to your clinic or to your hospital. You can call 811, and that connects you to the professionals. They'll probably put you through a checklist, and you tell them your situation, and then they'll advise you on what to do next from there. Again, I know this it's all precautionary measures. I know it's really easy to feel scared about this stuff, but you know what? We need to take care of yourself, take care of your family, take care of your friends, take care of each other. Don't get too caught up in all of this. I know it's hard to do and it's easy to say, but we really need to start working together and pull together here, and follow all the precautions we have out there, right? Panic buying. Do not panic buy. We have lots of stuff. And think about this. The stores are going to get restocked, but people that aren't able to get to the store, don't have transportation, maybe don't even have the money. I mean, people are on social assistance. That comes out not very soon, but they're waiting to get money so they can actually buy groceries. So they need those groceries to be there for those people. So please just think about that. I know it's kind of a self-fulfilling prophecy or a vicious cycle, because you're thinking like, well, these other people are panic buying. If I don't buy something, it's going to be gone because of those people. And that's the problem right there, right? So just buy what you need. I'm sure you have enough stockpiled already for lots of those people. They don't need to buy anymore. Just, think about each other out there. Be compassionate, be patient. We'll get through this together, right? Okay. So, everyone just take a deep breath and, appreciate each other, appreciate your family, appreciate our life that we have, and take care of each other. Okay. Let me know what you thought of today's episode. Hit me up on Facebook, CFNR Network, and leave your comments. Also, go to our website, cfnrfm.ca, and go to the App Store and download the CFNR app. That's it for me today. Until next time, let's see where the journey takes us.
This has been Journeys with Ryan Frank. Join us next time for more conversations about culture and the issues affecting First Nations people in BC. Brought to you by Prince Rupert Port Authority, linking a world of opportunity. Online, rupertport.com.